Hello, everyone. Facing the idea of a dementia diagnosis, either for yourself or for someone you love, can be incredibly overwhelming. But understanding how the process actually works can make the whole journey feel a bit less daunting. So let's break it down and walk through the step-by-step guide that doctors use. Have you ever misplaced your keys and had that little flash of worry, wondering if it's just a normal getting older thing or if it's something more? It's such a common thought, and it gets right to a crucial point. Dementia isn't a normal part of aging. It's a serious medical condition, and recognizing that is the very first step toward getting answers. Okay, so let's start at the very beginning. When we hear the word dementia, we almost always think of memory loss. But the truth is, the first warning signs are often much broader and more subtle than that. They can affect things like someone's judgment, their social habits, and even their mood. Yeah, so beyond memory, a big early red flag can be a change in judgment. This can show up in some really practical ways, like making uncharacteristic financial choices, maybe falling for scams they would have easily spotted before. Or it could even be something like a noticeable decline in personal grooming. These are all signs of a shift in what experts call executive function, basically the brain's ability to plan and make good decisions.
A change in social behavior is another huge one to watch for. Someone who used to be the life of the party might start to pull away from their hobbies or skip out on social events. And this isn't just about feeling tired. For them, social situations can start to feel really confusing or just overwhelming.
And remember, dementia affects the whole brain, which means it impacts our emotions just as much as our thoughts. You might see a person become easily upset, maybe suspicious of family members, or show new signs of depression and anxiety. It's so important to look at the whole picture, not just one single symptom. Noticing these signs is what should prompt that conversation with a doctor. And look, this first appointment isn't some scary, high-stakes test. It's really just a structured conversation designed to get all the information out on the table. So that initial appointment is basically a three-part investigation. First, the doctor is going to take a really detailed history, and they'll often want to talk to both the person and a family member to get the full story. Then they'll do what's called a functional assessment to see how these symptoms are actually affecting day-to-day life. And finally, a thorough medication review. This is essential because some drugs can have side effects that actually look a lot like dementia. A question as simple as this is really at the heart of the whole process. It's not an interrogation. The doctor is just trying to understand the person's own experience. They'll ask things like, when did the problems start? Did they come on suddenly or gradually? What specific things are becoming difficult? So after that first talk, the real detective work begins. This next phase is all about gathering objective clues through different tests and screenings. The goal is to build a clearer picture and, just as importantly, to rule out any other possible causes. Doctors use these standardized tools to get a baseline of how someone's brain is functioning. You might hear acronyms like MMSE or MOCA, but these are not pass-fail exams. They're made up of simple tasks like remembering a few words or drawing a clock, just to get an objective measure of thinking skills like memory and attention. A whole bunch of other conditions can actually mimic dementia. Something as simple as a UTI, a thyroid problem, or even a vitamin B12 deficiency can cause confusion, especially in older adults. That's why doctors always run routine blood and urine tests first, to check for any of these reversible causes. The last big piece of the investigation is often a brain scan, like an MRI or a CT scan. The main reason for this is to rule out other big problems, like a brain tumor, a bleed, or signs of a stroke. The scan can also show us certain patterns, like brain shrinkage, which can point towards a specific type of dementia. Okay, so with the detailed history, the cognitive test results, the blood work, and the brain scan all in hand, the specialist can now start to put all those puzzle pieces together. This is where they form a diagnosis and tell it apart from other similar conditions. One of the most critical jobs for a doctor is telling the difference between dementia, delirium, and depression. And timing is a huge clue here. Dementia is usually a slow, gradual decline over many months. Delirium, on the other hand, hits suddenly and can fluctuate like crazy. And with depression, a low mood usually comes before any major memory problems start. If dementia is the diagnosis, the next step is figuring out the type. And this is so important because knowing the type helps everyone predict the course of the illness and choose the right way to manage it. Alzheimer's, the most common type, is sometimes described as a bookshelf collapsing. New memories just can't be stored properly. Then there's vascular dementia, which often looks like a stepwise decline, with sudden drops in function caused by little roadblocks in the brain's blood supply.
Getting a diagnosis is, without a doubt, a life-changing moment, but it's also the start of a new path. The focus immediately shifts to management, to support, and to maintaining the best quality of life possible.
Managing dementia really rests on two pillars. The most important one, the absolute mainstay, is what we call non-pharmacological approaches. These are therapies and strategies that focus on the person, their environment, and their support system. Medications play more of a supporting role. They can help manage specific symptoms, but they are not a cure.
So, what do these non-drug approaches actually look like in practice? Well, they include things like cognitive stimulation therapy to keep the mind active, regular physical exercise, and adapting the home with memory aids and safety features. And, critically, it also means providing really strong education and support for caregivers, because they are absolutely essential partners in all of this. Now, on the medication side, drugs like donepezil and memantine can definitely help with symptoms in certain types of dementia, like Alzheimer's. But other medications, like antipsychotics, have to be used very, very carefully and only for short periods because they come with significant health risks. The goal is always to use the lowest possible dose that works for the shortest possible time.
Naturally, a diagnosis like this brings up a lot of questions about the future. And honestly, thinking ahead and getting a plan in place is one of the most empowering things you can do. There are some really crucial conversations that need to happen. Driving safety has to be addressed, and the diagnosis must be reported. The home needs to be assessed for any risks. And legally, it is so vital to set up what's called a lasting power of attorney for both health and finances. This has to be done while the person still has the capacity to make those decisions, to make sure their wishes will always be respected. And finally, I think the most important message here is this. A dementia diagnosis is not the end of the road. It's the start of a new journey, one that requires a whole team of doctors, therapists, social services, and of course, family and friends. Help and support are available. No one has to walk this path alone.